Sigmund Freud and Psychoanalytic Theory by me. Pause for dramatic effect. Quinn Borges. Sigmund Freud, a pioneer of psychological medicine, was born in the area now known as the Czech Republic in 1856. At the young age of 4, Freud and his family moved to Vienna, Austria. Vienna would be the location of his home and practice for the remainder of his life. He attended Vienna University for medicine, where he decided to specialize in psychopathology, the study of disorders on the mind. Freud began his work in psychoanalysis in 1886. He utilized the approach of his friend and colleague Joseph Breuer, which was new and different than what he had previously studied. Joseph used hypnosis to help reduce the severity of symptoms while they uncovered the root traumatic experiences behind it. Freud utilized this strategy in his clinical work until he reached the conclusion that instead of hypnosis, allowing the patients to speak about whatever it is on their mind or in their thoughts was more effective and consistent. This procedure, known as free association, was coupled with dream analyzation to overthrow the past theory of hypnosis psychology and usher in a new era of psychoanalytic theory. Dream analyzation became a focus of Freud's when he started to theorize about the 3 stages of the mind. The 3 parts, conscious, unconscious, and preconscious, all function differently as you sleep than during waking hours. When you are awake, the preconscious mind can retrieve a large amount of stored information but cleans itself out as you sleep. Information you believe will no longer be relevant, such as the license plate number of a tailgater, leave the mind, allowing room for unconscious thoughts to develop. Freud also theorized that the conscious mind acted as a buffer or sensor of thoughts stuck deep in the unconscious, and as you sleep, the unconscious mind develops the basis of your dreams. Freud would analyze the dreams of patients to recover repressed trauma that existed solely in the unconscious, as the conscious mind could not handle the pain. Another critical part of psychoanalysis is free association. This procedure is put in place by the psychologist reading a list of words and the patient immediately responding with the first word that comes to mind. This technique may not prove useful if the client shows resistance to the therapy, as it relies on the fast, unfiltered response of the unconscious to release information. Freud reported that his patients would frequently experience such a vivid memory that they almost relive it. These emotional outbursts would provide Freud with valuable information on the root of their problems. There are other smaller techniques of psychoanalysis that helped Freud resolve patients' problems. He used Rorschach ink blots, an ambiguous blot that had many possible outcomes when people would look and analyze the shapes in it. It was a way for Freud to see unconscious thoughts of the patients without any additional client work. However, this method is very subjectively based on what the clinician believes their analysis represents. Parapraxes, or Freudian slips, were an alternative way for Sigmund Freud to psychoanalyze patients. Freudian slips occur when the unconscious mind transfers information to your conscious mind, revealing what your mind is thinking by what you would accidentally say during sessions. In conclusion, Sigmund Freud and his psychoanalytic theory revolutionized the world of psychopathology by leading the way in many ideas and procedures on how the mind works and how to cure it.